I'm talking to Sharon Kastoriano. Sharon is an acupuncturist. Hi, Sharon, how are you?
Hi, Joanne. I'm fine, thank you. How are you?
Wonderful, wonderful. Sharon, you also work with Chinese herbs. Can you tell me a little bit about Chinese herbs? What are they, and what conditions can be treated with Chinese herbs?
Chinese herbs are, you're using plants, different parts of the plant, the leaves, the roots, the stems, and there's also some animal products that you use, but mostly they're plants. I mean, Chinese herbal medicine, it has a really long history, and it can be used it's very effective, I mean, for all types of conditions. I use them in my practice to help with fertility, but they can be used effectively for, I mean, digestive issues, headaches, migraines, asthma, allergies, all kinds of things.
What is the difference between a Chinese herbs and the medicine that homeopaths give out?
It's a different system, and I mean, it's very different. I don't know enough about homeopathy to be able to draw a good comparison between the two.
How effective are the Chinese herbs?
I mean, very effective, extremely effective. Again, they can be used. I mean, in China, for example, where Western medicine and acupuncture herbs are all combined into the same system, depending on the issue that somebody has, they really look to see, okay, is medication better for this condition, or are the herbs better to treat something? Or often they're also combined. And here too, I mean, if somebody's coming, for treatment for, say, migraines, for example, and they're on pain medication from their doctor, we can still prescribe herbs, in that situation.
Do the herbs work very fast?
In some cases they can, but usually in very, like if somebody has, for example, if they, say that they had food poisoning, you can, usually, you wouldn't see somebody for food poisoning, but the herbs that you give them would work within like 1 or 2 days, because you're giving sort of quite a strong dose. But usually you're seeing somebody that has, an issue that's been going on for a long time, so the herbs are, they're not working, I mean, they're working immediately, but you're, going to see the effects. So the effects are sort of slower. And so somebody, after sort of 2 weeks, 3 weeks, you're going to see the changes that you want to see.
What form do the herbs take?
There's what we call the raw form, which is like literally, like if you looked at the herbs, it looks like twigs and leaves, dried twigs and leaves, and you cook them and you make a tea out of them and drink it. For some people that's great. I usually use like them in a powder form, where they take those herbs and they're dried and then ground up, and then you're just mixing it with a little bit of water and drinking it. And they also come in pill form too.
And taste-wise, I'm sure everybody's thinking, do they taste nice? Does it have an odor or a distinct color?
Yes, yeah. I mean, it gets called a tea, but I always warn people it's not a tea. It doesn't taste, it doesn't taste terrible. It's an unusual taste for people, which is why doing them in powder form or, even in pill form, is easier for people to take them on a regular basis. Because that's the thing with the herbs. They're only as effective as, as the person taking them. So if they're only taking them once a week when they're supposed to be taking them twice a day, they're not going to work as well.
In what cases would it be inadvisable to take Chinese herbs? Is it safe to take it if you're pregnant?
The pregnancy question, you can give herbs in pregnancy because but I don't typically do that unless, for example, if somebody's had several miscarriages and they're pregnant again, then I would say that justifies using herbs in pregnancy to try to prevent another miscarriage. But typically, I don't. If the pregnancy is fine, then I wouldn't use herbs. Not because they're dangerous, but because I like to limit the things that a woman's taking when she's pregnant. Other situations, I mean, if somebody's on lots of different medications, I would be very cautious about using herbs and when they take them. But usually, I mean, if somebody, as long as you're working with a trained herbalist, they know how, which herbs may possibly interact with some medications, and so, it's safe to combine them.
Thank you, Sharon. Thank you so much.
You're welcome. Thank you.